guys, Dr. Beddoe here, physical therapist, and my wife Michelle, and today I want to talk a little bit about back pain and pelvic malalignments. So, if you guys are experiencing back pain, chances are that your pelvis is out of alignment. When you walk, your pelvis is moving, and sometimes the pelvis can get stuck. It can get stuck one direction, it can get stuck both, like opposite directions, it can get stuck anteriorly, posteriorly. But when the pelvis shifts like that, it's putting a lot of undue pressure on the spine, which is going to lead more towards back pain. Now, one test we can kind of understand if the pelvis is shifted is going to be a leg length test when you're sitting down in long sit, or you guys are laying down flat, and we're looking for the leg to be a different length than the other leg, and that's going to tell us what side of the pelvis is rotated, and it's also going to be able to help us be able to fix that problem really easily. So, if you guys are experiencing low back pain, you guys can do this test at home. So we're going to run through it right now. We're going to have two positions, and you're looking to see leg length discrepancy. So first one is going to be long sit. Your legs are out in front of you. You guys are sitting up like that. You want to look at the medial malleolus right here. You guys put your thumbs on it and see if there's a leg length discrepancy there. Michelle's legs are not shorter or longer than the other, but some of you guys are going to notice that one of them is going to be. It's only going to be maybe an inch, maybe a centimeter. But that's going to be enough to really indicate that your pelvis is really thrown off. If you guys don't have a leg length discrepancy in this position, go ahead and lay all the way down. And you want to check again. This is changing the angle of the pelvis, right? If you're long sitting versus if you're laying down. So if you guys do have a leg length discrepancy, and there's going to be one leg that's shorter than the other, then we really want to focus on hip flexion on this side. And I'm going to show you a useful tool that we can use to do this. It's really going to be able to put this in the optimal angle and be able to focus on the right muscles in the right way to get this back. So hypothetically, let's say that Michelle had a shorter leg on the right side and a longer leg on the left side, and she's experiencing low back pain because of that. So we want to take the back pedal and we want to put it so that our hip extensors, we're pushing down into our left leg, so we're engaging our hip extensors, and our hip flexors are being engaged on the right side, right? And so what that's doing is it's using your body's own muscles in an isometric contraction, because Michelle's going to push and pull against it, and the hip flexors are going to help rotate that pelvis anteriorly, and the hip extensors are going to help rotate it posteriorly, opposite directions, and it's going to reset on that sacroiliac joint, and it's also going to help shift your spine back into alignment and help reduce that back pain. So go ahead and push. 2, 3, 4, 5. Relax. Do it again. 1, 2, 3, 4, 5. Relax. Good. Now once you're done, we want to take this down. We want to put our legs, and we want to bridge up. Bridge up. Hold it in that position. Come back down. And then recheck. And what you're going to notice is you're going to notice that it's shifted. It may have shifted all the way back where now it's even. It still may be a little bit shorter, a little bit longer. Repeat as needed. And then I would recommend using this every day for 2 weeks to help to reset that joint until finally those muscles are strong enough where you don't have to do that anymore. And, your hips and your pelvis no longer fall out of joint alignment, and it stays in place. If you guys are looking to order this, go to thebackpedal.com. You guys can purchase it. Use the code #backpain. You guys will get 20% off from watching this video. And I hope that you guys have a better back pain free life. Have a good one.